Introduction. Meningitis is a significant medical condition that clinicians must be knowledgeable about due to its potential for severe complications and high mortality. This script will serve as a comprehensive guide to understanding meningitis, including its clinical presentation, classification, infectious etiologies, diagnostic approach, complications, and specific types such as bacterial, viral, fungal, aseptic, and neonatal meningitis. Additionally, vaccination strategies to prevent meningitis will be discussed. By the end of this script, medical students will have an in-depth understanding of meningitis, enabling them to identify clinical features, interpret diagnostic tests, and provide appropriate management and prevention strategies. Meningitis, defined as an inflammation of the meninges, which are the protective membranes surrounding the brain and spinal cord, can occur due to various infectious and non-infectious causes. The primary clinical features of meningitis include fever, headache, neck stiffness, and altered mental status. The severity of the disease can range from mild to life-threatening, and prompt recognition and intervention are crucial to improving patient outcomes. Meningitis can be classified based on the etiology into bacterial, viral, fungal, or aseptic meningitis, each having distinct clinical presentations, diagnostic approaches, and treatment options. The clinical presentation of meningitis can vary depending on the age of the patient, the underlying etiology, and the overall immune status of the individual. In adults and older children, common symptoms include sudden onset of high fever, severe headache, neck stiffness, photophobia, and altered mental status. Additional signs may include nausea, vomiting, seizures, and rash. However, in neonates and infants, the classical signs may be less evident, and presenting symptoms may include poor feeding, irritability, bulging fontanelles, and a high-pitched cry. It is essential to recognize these clinical features promptly to initiate appropriate diagnostic tests and treatment. Meningitis can be classified into different types based on the underlying etiology. Bacterial meningitis is primarily caused by organisms such as Streptococcus pneumoniae, Neisseria meningitidis, and Haemophilus influenza. Viral meningitis, on the other hand, is most commonly caused by enteroviruses, herpes viruses, and arboviruses. Fungal meningitis, although relatively rare, can occur in individuals with underlying immunosuppression, such as those with human immunodeficiency virus, HIV, infection. Aseptic meningitis refers to cases where the cause remains unknown or non-infectious. Understanding the classification aids in tailoring diagnostic and therapeutic strategies for optimal patient management. Bacterial meningitis is a medical emergency that requires prompt recognition and initiation of appropriate antibiotics. The most common bacterial pathogens causing meningitis include Streptococcus pneumoniae, Neisseria meningitidis, and Haemophilus influenza. These bacteria gain access to the central nervous system via hematogenous spread or direct invasion from adjacent infected structures. On the other hand, viral meningitis is typically a self-limiting illness caused by various viruses, with enteroviruses being the most common culprits. Herpes simplex virus and arboviruses, such as West Nile virus, can also cause viral meningitis. Fungal meningitis is predominantly caused by Cryptococcus neoformans and Candida spp. In immunocompromised individuals. Aseptic meningitis, characterized by sterile cerebrospinal fluid, CSF, cultures, is usually attributable to viral infections or non-infectious causes such as malignancy, drug reactions, or autoimmune disorders. The diagnostic approach to meningitis involves a combination of clinical evaluation, laboratory tests, and imaging studies. A lumbar puncture, LP, is the cornerstone of diagnosis and involves obtaining a sample of cerebrospinal fluid, CSF, for analysis. CSF analysis includes cell count, differential count, glucose and protein levels, gram stain, and culture. Additionally, nucleic acid amplification tests, NAATs, can identify specific pathogens quickly. Blood cultures should also be obtained to identify potential bacteremic causes. Imaging studies such as computed tomography, CT, or magnetic resonance imaging, MRI, of the brain may be necessary in specific clinical scenarios to evaluate for complications or assess for underlying structural abnormalities. Meningitis is associated with several potential complications, some of which can be life-threatening. These complications include brain edema, increased intracranial pressure, hydrocephalus, cerebral herniation, seizures, cranial nerve palsies, subdural effusions, and cerebrovascular complications such as vasculitis and stroke. Early recognition and appropriate management of these complications are crucial to prevent long-term neurological sequelae and reduce mortality. Bacterial meningitis is a severe form of meningitis that requires immediate recognition and treatment. The most common bacterial pathogens causing meningitis vary with age, immunization status, and regional epidemiology. Prompt administration of appropriate antibiotics, such as ceftriaxone or cefotaxime, targeting the likely pathogens, is essential. Adjunctive therapies, including dexamethasone for certain bacterial etiologies, can help reduce the risk of long-term complications. The management of bacterial meningitis also entails rigorous supportive care, including close monitoring of vital signs, maintaining cerebral perfusion, managing seizures, and fluid and electrolyte management. Viral meningitis is most commonly caused by enteroviruses, which are responsible for the majority of cases. The management of viral meningitis focuses on supportive care, as antiviral therapy is generally not indicated. Symptomatic treatment targeting pain, fever, and hydration is crucial. Patients with viral meningitis usually recover without any specific interventions or long-term sequelae. However, certain viral infections, such as herpes simplex virus, may require specific antiviral therapy and close monitoring. Fungal meningitis, although relatively uncommon, carries significant morbidity and mortality, especially in individuals with compromised immune systems. Cryptococcus neoformans and Candida spp. are the most common pathogens causing fungal meningitis. Management typically involves long-term administration of antifungal agents, such as amphotericin B and flucytosine. Close monitoring, serial lumbar punctures, and assessments of antifungal drug levels are important for optimizing therapeutic outcomes. Aseptic meningitis refers to cases of meningitis where the cause remains unknown or non-infectious. Most commonly, aseptic meningitis is viral in etiology, with enteroviruses being the leading pathogens. The management of aseptic meningitis mainly involves symptomatic treatment, including analgesia, antiemetics, and hydration. It is essential to consider non-infectious etiologies as well, such as drug reactions, autoimmune disorders, and malignancies, as prompt identification and management are essential. Neonatal meningitis presents unique challenges due to specific pathogens and a higher likelihood of severe complications. Group B Streptococcus, Escherichia coli, and Listeria monocytogenes are common causative agents of neonatal meningitis. Early recognition, prompt administration of empirical antibiotics, including ampicillin and gentamicin, and appropriate supportive care are critical. Close monitoring and management of potential complications, such as seizures and hydrocephalus, are necessary in this vulnerable population. Immunization plays a vital role in preventing meningitis caused by vaccine-preventable pathogens. Vaccination strategies focus on the administration of vaccines against bacterial pathogens like Streptococcus pneumoniae, Neisseria meningitidis, and Haemophilus influenza. These vaccines are recommended for routine childhood immunizations, as well as for individuals with underlying medical conditions or increased risk of exposure. Vaccination efforts aim to reduce the burden of meningitis and its associated complications. In conclusion, meningitis is a significant medical condition that requires prompt recognition, diagnosis, and appropriate management to reduce morbidity and mortality. Understanding the clinical presentation, classification, infectious etiologies, diagnostic approach, complications, and specific types of meningitis is essential for medical professionals. Additionally, vaccination strategies play a crucial role in preventing meningitis caused by vaccine-preventable pathogens. By gaining a comprehensive understanding of meningitis through this detailed script, medical students will be better prepared to diagnose, manage, and prevent this potentially life-threatening condition.